of all, may I have your permission, both of you, to use this video for educational purpose and on internet?
Yes.
Okay. Now, first question. How old are you?
79.
Soon you will be 80, I hear.
Yes.
Well, congratulations in advance. Now, our surgery was 4 months ago, and we did not do a small surgery. We did this surgery. We did a surgery on the bottom four vertebrae actually, and two of the discs we had to take out and put a spacer in and lift it up. It actually 4 months ago, bone is beautifully growing. And I'm very happy with what I see here. Everything is well connected, nothing is pulling out or moving the wrong direction. So do you remember the surgery?
No, I was sleeping.
Good one. But how long did you stay in the hospital?
6
He
days.
was 5 days.
5 days.
Why did you stay that long?
He was having a problem with that leg caving out on him.
Yeah, so you had some problem in the leg. You remember before the surgery we talked about that sometimes when I pushed on the nerve, that nerve become angry. So that kept you longer because most of my patients go home next day. But you, this is what it is. This is a realistic expectation management for a patient that not everything goes like
100%.
100%. So you had some problem with the leg, you stayed longer in the hospital. Now, let's talk as well about the, when you went home. How long did it take you to be able to do basic daily activities? Like,
About a month.
take care of yourself. 1 month.
A month, a little over 5,
Yeah.
6 weeks maybe,
No.
before I started showering.
Yeah, okay. Now, before the surgery, let's start with the back pain. How bad was the back pain before the surgery?
I don't know, 6, 7.
6, 7? How bad is it
Maybe.
now?
I don't have it. You're sitting there.
No, but when you do something, sometimes you have some back
Yeah,
pain?
yeah, a little bit.
A little bit too. So from 6, 7 to 2,
Yeah.
that's pretty good 4 months after the surgery. Now, you had leg pain, correct? No, but before the
Yes,
surgery.
yes.
How bad was the leg pain before the surgery?
Oh, 6, 7.
How bad?
8.
8. Okay, she remembers it better than you.
He wasn't doing anything.
Yeah. How bad is the leg pain now?
I don't have any.
Okay. Now, you still have some numbness on top of the
Yeah.
left foot.
Yeah,
How much does it bother you?
doesn't.
Doesn't. Okay. Well, and that as well usually comes back after a few months. Okay. So now, you asked me a few questions that makes me actually happy because if you wouldn't feel like that, you wouldn't ask those questions. But still might be a little too early, especially considering that you're dealing with a body that is 80 years old, not 40, right?
Yeah.
So what do you want to ask me the question again? What question did you ask me if you can do those things or not?
When can I?
Do what?
Get in a skid steer and plow my snow and
Yeah. You
put wood in the stove.
Yeah. No, these are questions people usually ask them when they feel like that, but then they want to be sure that they're not damaging anything.
Yeah.
Do you feel you're ready for that? For skid steer and loading woods and so
Well,
on in the stove?
I don't know. That's
But-
why I'm here talking to you.
But generally, that is what it is. People,
Now that I know that I didn't damage anything, if I go into the skid steer,
not
and start-
damage anything because you have done few things and
I fell.
fell as well and so on. Okay. No, you didn't do any
He
damage
has
there.
to try it and see how
Yeah.
it goes.
So,
Yeah.
so if I have problems, I'll quit.
Okay, well, this is what my answer is to all my patients. Literally, when you feel ready, and most of the time when people ask me, they feel they're ready. Otherwise, they would know they're not ready for that. You do a little of it and you watch yourself. And you watch yourself for a few days. And then do a little more. And then you do a little more. Okay?
Yeah.
Now, this is the fact. I did not make you 40 years old. I think that's beyond me. But, everything is good inside. Now, the back pain and leg pain are practically almost gone. And now we have to make you a normal person. And by starting doing things and adding to that a little more and a little more until you understand that you cannot go beyond that. And your body will let you know by giving you pain. Now, you remember I told you it's time to make you a normal person. It's time to make you a normal 80-year-old person, not a normal 40-year-old person. And there are huge differences there. because no matter even with surgery, without surgery, if you try to live as you were 20, 30 years old, you're just going to do some damage. Okay? Now, I'm very happy. We are very good. This is all good. And obviously your case wasn't perfect because you stayed much longer than any of my patients because you had the problem, we had problem with the ambulation now. But this is still good. 4 months later, pain is gone, you're ambulating, you're returning to life. And after this big surgery in your age group, regular recovery after normal surgery is usually 2, 3, 4 times longer than this. Now, overall, any other question or comment for me? No? Yes, please.
When he walks very far, he has cramping in his back right across here.
And that
Will that go away if he walks more?
no. If you have pain, generally pain means that
You're
it's
gonna
enough
stop.
stress. Pain is always a sign. Pain is not the problem. Pain is a sign that something
Right.
yet you're doing your body doesn't like. So in this situation like this, don't try to overcome it. Just let pain guide you.
So
Okay.
he can't walk very far yet.
Well, it's whatever it is, we are just going to have to add to it little by little.
Okay.
Okay, and again, we come all back to that an 80-year-old body it recovers just slower than a 40-year-old body. You just have to let your body heals and it recover at the rate it likes. Okay. Any other comment?
No.
Okay. Now, how does it feel not to have the pain though that you had before the surgery? Are you
Mighty
satisfied
good.
with that? Mighty good.
You
Okay.
bet.
Yeah.
I'm satisfied.
Okay. Very good. Well, thank you so much for the interview. I appreciate that.